Hello and welcome. Today we are going to talk about 8 ways to optimize health and longevity and specific testing measures that you can do, as well as lifestyle interventions. Hi, my name is Dr. Missimer. I am a functional medicine practitioner, doctor of physical therapy, registered dietitian, and I am a medical educator for Rupa Health. And I'm super excited to talk to you about this topic that is near and dear to my heart. So what is longevity? So longevity refers to the length of an individual's lifespan. However, we also want to factor in that it includes health span, which is the number of years on Earth that you are living in good health, free from chronic disease. Now, we want to think about longevity as it's affected by so many different things, from genetic to environmental and, of course, lifestyle factors. So I think the question that we want to ask our patients, or we want to ask ourselves, is what exactly are we trying to optimize? What is it that we want our lives to look like? Do we want to live to 120? Do we want to be able to play with our grandkids and travel and be able to get down onto the floor and get back up without pain, maybe not use a walker? What are the things that are important to each and every one of our patients and ourselves that we need to be factoring in as it relates to longevity? So with that said, what we are often thinking about and what's often very important to most people when we really dig in is prolonging health span. So by delaying or preventing age-related, lifestyle-related conditions or disabilities so that you have more years with good health. We also want to think about enhancing overall well-being. So that's emotional, mental, physical well-being, being able to feel connected to yourself, to the greater world, being able to do the things that you want to do. And I love using the word vitality, so feeling your best each and every day. So when we're looking at longevity, we want to think about all of the factors that are influencing it, from physical and cognitive health, environment, lifestyle behaviors, emotional health, social connectedness, purpose, and even, of course, genetics. So we're going to look at all of these different domains and how we can actually test for different measures that we can test and retest. We can look to be more preventative and proactive in our approach to longevity as opposed to reactive. And we'll also talk about some lifestyle interventions that you can do with your patients or you can do yourself. So let's start with cardiometabolic health. So heart disease is still the leading cause of death for men and women and people of most racial and ethnic groups in the U.S. One person dies every 33 seconds in the U.S. from cardiovascular disease. Coronary artery disease is the most common type of heart disease, killing over 375,000 people in 2021, which of course is most likely increased now. And in heart attacks, someone has a heart attack every 40 seconds. So why is this so important? That this is such a huge area that we have to focus on and we have to be more proactive. So when we are typically getting our standard evaluation of cardiometabolic health, we might get a fasting blood glucose, we might get a standard lipid panel, but this does not give us a complete picture, not even close. And we can begin to start to be aware of this, whether we have a family history of heart disease or don't have a family history. Either way, it's important to get a really good understanding of your cardiometabolic health because we can prevent so much more. So when we can do more detailed analysis, such as this cardiometabolic profile, this is by doctors' data, we can begin to look way more in depth about what someone's risk actually is. So for example, if we're looking at just our standard triglycerides, HDL, LDL, VLDL, etc., we are not getting that complete picture. So we might say, oh, our numbers are high, let's go on a statin and move on. But really, we don't even know if someone should actually be on a statin or not. What are the other interventions that they need? So for example, we might want to look at something like oxidized LDL, which is going to give us a better picture. We would want to look at something like ApoB, which is actually the main protein found in LDL, and that's going to give a more accurate representation about how much LDL is in the blood and how much risk someone is actually in. Something like Lp(a) is also another factor that only really needs to be tested once, but can give us an indication of how much risk you are for atherosclerosis. So there's so much more that we can understand when we look a little bit more in depth. Things like looking at homocysteine, which is an inflammatory marker that can also predict more cardiovascular disease or events. And in addition to that, we also want to consider things like looking at fasting blood glucose as the standard, but oftentimes we wait and see. So it starts to creep up to 97, 98, 99, and then all of a sudden it's elevated. And then we run a hemoglobin A1C, which is a 3-month snapshot of your blood sugar. But what if we started to really pay attention to this earlier? What if we looked at fasting insulin? What if we looked at some other data to prevent prediabetes, to prevent diabetes? Because these are the things that are playing such a huge role in our overall metabolic health and therefore longevity. So what can we do? As practitioners, we want to look more in depth, looking at more comprehensive cardiometabolic testing to truly understand a patient's risk. But as a patient, you want to be asking your provider to do more testing, to be able to understand what your risk is. Maybe perhaps doing a calcium score to look at how much atherosclerosis or plaque buildup there is. Also, we want to think of things like how can we manage blood sugar and hypertension more effectively through diet, such as a Mediterranean diet, which is the most well-researched diet that is helpful for cardiometabolic health. Also, of course, exercise is one of the most powerful things that we'll talk much more about, and stress management. And then also things like optimizing nitric oxide production. Please check out our other video on 6 ways to improve your nitric oxide. So now let's talk a little bit about gut health. So this is something that I love to talk about because this has such a profound impact on our overall health. Let's say, for example, we're just speaking about the gut-brain connection. The gut-brain is a bidirectional communication between the gut and the brain that has different pathways. So we have indirect pathways and direct pathways. We have top-down pathways and bottom-up pathways. And all of this really is ever evolving, but it's influencing so many aspects of our health. So from the first connection being the nervous system, think of the vagus nerve as going to be the main connection as it relates to the neural circuit of the gut-brain connection. We have neuroendocrine and our HPA axis, so our stress pathway of our body. We have our immune system, so we have tons of lymph in our gut, and that is influencing our overall immune system. And we also have our microbiota-derived neuroactive compounds like dopamine and serotonin and GABA, which helps decrease feelings of fear and anxiety. All of these are metabolites that are contributing to the overall baseline of these neurotransmitters. But as you can appreciate, there are hormonal, immune, metabolic, and neural connections of the gut-brain. So it is vital that we are looking at our overall gut health. And it's also been shown that over 50% of all disease, upwards of 75%, is associated with excessive or persistent inflammation. So when we are beginning to look at root cause medicine, we absolutely want to look at the gut. This is one of the tests that I do the most frequently because I'm seeing so many people with so many complex medical conditions. So in this instance, I use the GI map. There are a lot of great GI stool tests. And what we're looking for is everything from what bacteria do we have? How much commensal bacteria is there? How much opportunistic bacteria that can contribute to inflammation and even autoimmune disease? How does their intestinal health look like? So in this, how are they digesting their fats, the steatocrit? How are they digesting their other proteins, carbs? And when we look at this, in this example, this person is not digesting their food very well. So that is going to cause a whole host of downstream effects. Increased dysbiosis, an imbalance of bacteria, an increase in this case of inflammation. This person was also very sensitive to gluten, so that's why their antibodies to gluten were extremely elevated. Signs of leaky gut, their calprotectin, which is a really important inflammatory marker to differentiate IBS, irritable bowel syndrome, with IBD. this is extremely elevated. So we can start to see so much from a stool test and see how it is influencing this person's overall health. So now let's talk a little bit about nutrition and biochemistry. So of course, there's so much controversy on what to eat. So should we be vegan? Should we be plant-based? Should be a carnivore? And really, I think if we put all of those things aside, we should really be looking at nutrition and biochemistry for each individual person and really look at objective data to see how is the way that this person is eating affecting their health. And that way we can get away from what's good, what's bad, what's right, what's wrong, and really begin to look at how this information is affecting your overall health as we're working towards longevity and improving health span. So this is the NutriEval test, which is an amazing test that you could see in this picture, the functional imbalance score. So everything from the need for antioxidant support or mitochondrial support, or how someone is methylating, the need to reduce toxic exposure or support for inflammation, reducing oxidative stress. It's a really, really powerful test that when you pair it with a person's clinical presentation, it can be extremely powerful to, again, look at more objective data instead of guessing what's right, what's wrong, to be able to say, this person is really in need of omega-3 support. This person seems like there's a lot of dysbiosis and malabsorption that's occurring, and that is why they're extremely deficient in B12. And you can also start to pair these tests to be able to get a more complete picture, but it's looking at everything from organic acids, amino acids, fatty acids, oxidative stress, and toxic markers. So it could be really, really great. And if you are not able to do a test like this, I think something that could be really powerful in clinic and at home is something like chronometer. So the one thing, of course, that it has a huge limitation on is we don't know how well we're absorbing these nutrients, but this is a great free way to begin to use with your patients and be able to get a better understanding of what they're eating and what they're getting in their diet and not getting in their diet. So it can give a really complete picture of nutrition scores. So how many vitamins and minerals and electrolytes, immune support, antioxidants you're getting. And also we can see, where are we limited? What areas do we need to really emphasize from our macronutrients? But what's really fun is looking at the micronutrients, because ultimately every reaction in the body requires nutrients to be able to work effectively. That is our biochemistry. And so when we can begin to really look at, we want to improve mental health, and we realize that this person is having a really challenging time with motivation and pleasure, then we might say, okay, so let's look at what are the nutrients that they need to produce dopamine. And so then we begin to unpack that. So they need phenylalanine, they need tyrosine. So we could begin to look at the nutrients they need plus B6 so that we can see, are they getting these things to produce enough dopamine? And that's where this could be a really, really nice complement. Or if you're not able to do a more elaborate test like the NutriEval, you could do something like this. The next area that I think is really important as it relates to longevity is hormones. So we could talk a really long time about this, but as we are aging, all of our hormones are shifting. And that is perhaps one of the things that we notice quite a bit when we get older. So men, for example, might really start to feel and be aware of the decline in testosterone. So that can start to decline at the age of 30. And so that could present for one man as they have decreased sex drive, they have poor ejaculation, and then another person might have low T levels by objective data, but be totally fine and not symptomatic. So it's really important to always look at clinical presentation along with the testing. But as it relates to women, if we're thinking of all the changes that they're going through from perimenopause to menopause to postmenopausal, it can definitely play a huge toll. It can be an inflammatory driver. Women will start to experience a shift in their fat distribution. from their hips, their pelvis to their abdomen. So not only are they affected emotionally, but definitely physically and mentally. They can begin to have more hot flashes. And so when we're thinking about this, whether or not someone decides to do hormone replacement, then looking at hormones in more depth is really important. So something like a Dutch test is an extremely powerful test that is going to look at a very comprehensive picture of where someone is. So in this case, this would be something that would be very highly recommended if someone was going to go on hormone replacement, but also just to get a better understanding with what is happening. So is cortisol driving this person's issue? So is this the thing that is really creating so much imbalance and a lack of homeostasis in the body? And oftentimes it is, but we can look at that. We can look at DHEA, we can look at cortisol patterns. And so there's just a really, really comprehensive look at metabolites, and this can help drive decisions from botanicals and supplementation to potentially hormone replacement. Okay, so next area is looking at sleep. So this sleep and airway is really something that is so powerful that I think is often overlooked and missed quite frequently. And I have the pleasure of being able to work very closely with a local dentist who is an airway and sleep specialist. So we work together with a lot of different cases. And I think the important thing to recognize here is sleep really governs all, right? So if we're trying to think about nutrition and fitness, but we're not sleeping well, then we're missing a huge, huge aspect of health and longevity. And so if we look at the spectrum of sleep disorders, we are going to start off with mouth breathing. So if you are unable to breathe through your nose for at least 3 minutes, and you start to move into mouth breathing, then this is going to be your first sign that there is likely some kind of obstruction or inflammation that's happening. So the next phase of that can be upper airway resistance, which is often missed quite a bit. This can present as difficulty falling asleep, restless sleep. It can cause fatigue and daytime sleepiness, mood disorders, anxiety, constantly being in a fight or flight. Except what's interesting about this is it's often missed because it is not obstructive sleep apnea. So in this case, you don't have to have as many events of not breathing during the night as you do with sleep apnea. So then it progresses though to snoring, and then mild sleep apnea, moderate sleep apnea, severe sleep apnea, and then hypoventilation syndrome. So there is an increased progression to this over time, and I see it every day, all day in my clinic. And so I'm referring for people for airway evaluations regularly. And this happens to be one person that I work with who is delightful. And one of her biggest goals, she exercises regularly, she eats great. And one of her biggest goals is to be as healthy as she can into her older years. She's in her 70s right now. She wants to prevent Alzheimer's because her mother passed away from Alzheimer's. And this was a really good example of she did her airway evaluation, and you could see at the top where her pictures are and then what it looks like at the bottom. And in this situation, so her airway itself is okay, but she does have some erosion in her jaw. So it's one thing. So that shows that most likely she is clenching. There was some bacteria that was built up in her sinuses. So she's had chronic sinus infections. And then also if you look at her palate, so you can see compared to the healthy palate, you can see how narrow it is. And then you could also see her tongue range of motion. So what's happening is she's having a hard time keeping the tongue at the roof of the mouth, which is where we need it to be for optimal airway function. So these are some things that you can do to look at your overall airway or for your patients. So first, are they able to breathe nasally for at least 3 minutes? You can also pull apart here and see if they're able to breathe in without, as you pull this apart, are they able to breathe in more freely? You could do a CO2 tolerance test. So this is actually a more objective test to look at the their tolerance to CO2 in the bloodstream. So what you would do with this test is you breathe in normally, breathe out normally. You hold, so you're holding at the bottom of the exhale, holding your breath at the bottom of the exhale for as long as you can until the very first urge to breathe is. Our ultimate goal is about 30 to 40 seconds. So if you are under 15 seconds, it's going to be indicative of a more severe airway issue. You can look at nasal valves. You can look at, do you have any TMJ issues, clicking, popping? You can look at the Mallampati score. So are you able to easily see the uvula in the back of the throat, or is it covering that? Is there any tonsil hypertrophy? Is the tongue, do we have adequate tongue range of motion? Is there a narrow palate like I just showed you? Is there tooth wear on the enamel? And a sleep study. So the patient I just referred to was very fascinating in that she finally got a sleep study and she has central sleep apnea and obstructive sleep apnea. So this was the most powerful information that we could have, because this is what's going to truly help her live into her older years in a much healthier way. The next thing is a Dexa scan. So when we're thinking of one of the things that causes a very rapid decline, it's when someone has a fall. And 1 in 3 adults aged 50 or over dies within 12 months of suffering a hip fracture, which is unbelievable. And older adults have a 5 to 8 times higher risk of dying within the first 3 months of a hip fracture compared to those without a hip fracture. And this increased risk of death remains for almost 10 years. So getting a Dexa scan, being able to understand that it's that moving x-ray, about 10 minutes, it gives the ionizing radiation, but it's looking at different bone mineral content, fat, and others. So it can also give a really good indication of muscle mass as well, if you're looking from a body composition standpoint. But it is something that is super powerful to get an understanding of and then figure out why that might be happening. If you have osteopenia or osteoporosis, what are the reasons that you have that? Is it a loss of estrogen? Is it your diet? Is it a lack of absorption? So some of the things we've already spoken about. And next we'll talk on the same lines of this, which is sensory stimulation. So our peak sensitivity in our feet of mechanoreceptors at the age of 40 years old. By the age of 70, we need twice as much stimulation to create the same exact response. We have all of these different mechanoreceptors on the bottom of the feet. These are called fast adapting, and then we have slow adapting mechanoreceptors. And ultimately, this is the information that's coming in through the bottom of our feet, the skin, to our brain for us to respond. And so it is extremely vital that we have optimal nerve health, and that is also going to be based on all the things we just mentioned as it relates to nutrition. So think of our B vitamins, our magnesium, our omegas that we can all see in that NutriVal test. But we also want to think about all of these different receptors that are responding to different stimuli. And so here, essentially, we have our slow adapting, our fast adapting. And the slow adapting is essentially something that we want to focus on stimulating with texture. And so the Naboso technology is a great way to do that because it is specifically designed as 1 millimeter apart, and it's stimulating the Merkel disc in the bottom of the feet. So we want to think about going barefoot at home, walking outside into grass, not blocking the information with shoes and socks all of the time, because as we do that, our foot gets less and less responsive to stimuli. So the next is our grip strength. So this is something that I find to be really fascinating. So grip strength is also a predictor of mortality, disability, complications, and increased length of hospital stay. So years ago, gave a whole presentation on this, but one of the things that I think is fascinating is a lower baseline hand grip strength predicted an accelerated decline in activities of daily living and cognition. And it is actually a widely accepted indicator of nutritional status, bone mineral content, muscular strength, and integrity of the upper extremity. Now, I think the reason for this is that we can't have just good grip strength. We have to have good overall strength. So when we're looking at this through a functional lens, the more overall strength that we have, the more functional we are going to be. So if we are going to pick something up, if we are going to reach for something, we need to be able to coordinate our grip with the rest of our body. And so that's why I think it is really a combination, but it's a great way to look at it. And we can do that through something called a dynamometer. That's the official way that you can test your grip strength. And so we have those in a lot in different physical therapy clinics, sports medicine clinics. But you could also do something like a loaded farmer's carry. So if you are thinking more functional, so you can grab 2 dumbbells or kettlebells and you can see, are you able to walk? So the measure, if you will, would be for women and kids about 35 pounds in each side. So it's 70 pounds total. Obviously, wouldn't start with that, but you could see, is this something that you could work up to for 30 seconds? All right, so now we're going to switch gears into cognitive testing. So and when we're thinking about cognitive health, at the age of 40, we start to have cognitive decline. And at the age of 60, a neuropsych evaluation is recommended. So when we're thinking of our cognitive health, there are actually 3 stages of cognitive decline. So we have a preclinical where you might notice some minor memory loss. Then you can have a mild cognitive impairment where you forget names, you go into a room and you forget what you're looking for. And then there's dementia, which can interfere obviously with day-to-day capabilities. And then we also have Alzheimer's, which is a neurodegenerative disease, and that does have a different process. So for example, there can be a genetic marker for that, which is ApoE4, which is something that we could test for, but it also is considered type 3 diabetes. So it is going to be greatly influenced by blood sugar. So as I mentioned before with cardiometabolic health, we want to be measuring those things early on so that we can actually prevent it. And then along with cognitive health, I think it's really important to do something like the NutriEval or an oat test, an organic acid test, to be able to really get a great understanding of what someone's nutritional status is, what do their metabolites look like, things like dopamine and serotonin, being able to just get a better picture on all of those. And I think also with cognitive health, there's a lot of other very specific measures you could do along the way, looking at different blood markers, especially something like looking at your omega-3, omega-6 index. And what are some things you can do cognitively with your patients or for yourself? So many, but I just wanted to give a couple examples. So one is, in order to have optimal memory and begin to act from our prefrontal cortex, so insight, ration, we have to be in a safe place. So that's really important because if we're in fight or flight or we're in a freeze state, unfortunately, we won't be able to learn and optimize the hippocampus in our brain. So one of the things that I love to think about as improving our cognitive health, improving our ability to focus and have attention, is actually utilizing techniques to optimize our reticular activating system in our brain. So this can be things like stimulating the tongue ligaments, for example. So the tongue ligaments are going to be connected to the vestibular system. So when we do things like yawn, or we push the tongue to the roof of the our palate, when we rub our ears, all of these things can actually wake up our reticular activating system, making it easier to focus on something very specific. So we can also do things like a cross crawl pattern. So we can bring our elbow to our opposite knee. That's a great way to cross the midline, so i.e. the corpus callosum in the brain, and being able to improve the ability of the 2 halves of the brain to communicate. We could do things like dual tasking, so walking backwards as you count backwards from 3 from 100. So things like 100, 97, 94, You can balance using colors and the alphabet. You can, of course, what we talked about was stimulating your feet. So barefoot stimulation is really crucial for this. You can also incorporate meditation or encourage your patients to incorporate meditation in their lives, because this is a great way to help improve attention and focus. Most often we think of meditation as just a way to relax, but actually mindfulness awareness is about improving your attention and focus. So when your thoughts begin to ruminate, you can redirect your attention back to the present moment, your breath, your feet, and so on. And also we want to think about the important role that our eyes have in our brain, because 60% of our brain is involved in vision in some way. So improving our ability to stabilize our gaze. So things like holding your finger out in front and using gaze stabilization techniques can be really powerful. So now let's talk about the social aspect. So people with stronger social bonds have 50% more increased likelihood of survival than those that have fewer social connections. And I think that is the key word, is connectedness. There are some people who don't like to go out into parties and events, and they feel very connected to themselves and to the greater world. So when we're thinking of it, it can be as it relates to each person. However, we know that social connection can help prevent disease like heart disease, stroke, dementia, depression, anxiety. And there's different surveys that we could use for this. One of them is a Watts Connectedness survey. So it's something you can access online to just get a baseline of how connected you might be, and maybe is this an area that you want to focus on through your older years. And of course, I always love to reference Dr. Stephen Porges' polyvagal theory. Without getting into great detail about it, we like to think of how our nervous system expresses itself in these three distinct ways. Our state of social engagement, where we're connected, we're joyful, we're grounded, we're curious, we're compassionate. We have our fight or flight, which of course we're very familiar with, where we could be frustrated or then irritated or angry, or we're worried or concerned or anxious or fearful. And then we have our freeze, where we become disconnected, our emergency state. We feel numb, we procrastinate, we know what we should do, but we don't do. And just understanding this without going into, again, great detail right now is really important. It's one of the most powerful things I do with my patients is show them this visual and help them understand their nervous system, because then they know that they have power over their nervous system and they have control, because all of these things are going to affect their physiology. And so being able to appreciate why someone might have high blood sugar is really important. Maybe it's because their cortisol is very dysregulated that's contributing to that. So helping them understand this is really valuable, so we can take our objective measures from our labs and combine it with this emotional and social aspect. And purpose is really, really vital as we get older. We often are times are not working, or we worked all our lives and maybe now you're retired, and so our patients don't necessarily know what to do. And a stronger purpose in life is associated with lower all-cause mortality. So things like volunteering, well-being therapy, whatever that might be for you, meditation, again, can be really valuable. And I always encourage my patients and in my groups to write out their purpose. So I think that's really something important to reflect on day in and day out, and making sure that what you're doing as you improve your health span is in line with your purpose. So mine is to teach, inspire, and empower people to live consciously and courageously, lift other spirits with love and compassion, to live fully and freely, and to make this world a better place. So enjoy that for yourself as a practitioner, but also for your patients. I think it's a really powerful way to focus on their health span. And we can't forget talking about genetics. So there are obviously certain genetic factors that are going to predispose us to different conditions. And where I used to have a different opinion about genetics, I have definitely shifted my way of thinking. And in that, when we can begin to understand our genes, we can also begin to make changes to support our health differently. So for example, something like looking at a methylation panel and understanding how a person is methylating. Do they have the MTHFR gene? How is this affecting their folate and B vitamin metabolism? How is it affecting them as it relates to bioidentical hormone replacement or their infertility or their chronic fatigue? We can look at, again, the ApoE to see if someone at risk for Alzheimer's disease, and why is it so important to get annual measures of their metabolic health so that we can be proactive. There is a FOXO3 gene, which is actually the longevity gene. That's also something that we could see if that is something that may affect us into our older years. But we can also do something like a 3x4 genetics test where it can look at all of these different aspects, and then that can influence our nutrigenomics. So again, what are the things that are really important for us? What are the things that we should limit as it relates to nutrition and lifestyle? And ultimately, it's going to give us more personalized health insights. It's going to help us to prevent things, enhance our overall mental, emotional, and physical health, and we can have tailored lifestyle adjustments to support those things.
Welcome to Rupa Health, the best place to order, manage, and track results from over 30 different lab companies in one single place for free. It's going to take you under 2 minutes to sign up, and you can order any functional medicine lab for your client in under 30 seconds. Let me show you how it's done. So here's our beautiful interface. I'm typing in the name of my client, selecting the lab that I want to order for them, and hitting send. From there, Rupa and their amazing team handle the rest. They email the client, collect payment, and even offer an interest-free 3-month payment plan. We've also built the world's largest library of information about chronic health conditions, the lab tests that can help you find the root cause, and the evidence-based interventions that you can use to help people heal from them. It's called the Rupa Health Magazine. There, we have in-depth articles about almost any health condition you can imagine. And we give you step-by-step protocols that other clinicians have used to help their clients heal and that are verified by evidence-based sources. You should totally check it out, and it'll transform your practice. And we can't wait to see you. So make sure you sign up today at rupahealth.com.